Understanding Medicare and enrolling in coverage is easier than you might think. I'm Russell Noga, independent agent and owner of MediSups.com, and I'll show you the easiest way to enroll in Medicare, as well as cover options that you might want to consider once you're enrolled. Welcome to our New to Medicare video. Here I'll be discussing the differences between the various parts of Medicare and how and when to enroll so you don't miss any deadlines. Now remember, Medicare begins the first day of the month you turn age 65. If you're born on the first of the month, it begins the previous month of the month you turn 65. So when you do turn 65, if you've worked approximately 10 years in the United States and you've paid into the system, you're eligible for both Part A and Part B Medicare. Or if you're under 65, you've been on Social Security disability for 24 months, you also may be eligible. Now, here are the different ways to enroll in Medicare. If you're drawing a Social Security check when turning age 65, you'll automatically be enrolled in both Part A and Part B Medicare. Medicare will send your card in the mail about 3 months prior to you turning 65. If you don't want Medicare Part B at that time, for example, you're still working, getting employer benefits, you'll want to fill out the card they provide you and send it back to them and opt out. Otherwise, you'll be enrolled in both Part A and Part B. Now then, you can enroll in a Medicare supplement plan as well as a drug plan if you prefer. Now, to learn about those plans now, just give me a call at 512-402-7902. If you're not drawing a Social Security check when turning 65, you need to sign up for Medicare yourself. Now, you can do this one of 3 ways, and you'll want to do this again about 3 months prior to turning 65. To sign up for Medicare, you can choose from these 3 different options. You can call them direct at 1-800-772-1213. You can enroll online at www.medicare.gov, or you can visit your local Social Security office, but I would suggest make an appointment first. Now, if you are still employed and receiving health benefits from your employer and you don't wish to have Part B at this time, then just let them know when you're enrolling in Part A. Now remember, there's a monthly premium that you'll have to pay for Part B, so you want to avoid this as long as possible if you're still getting employer benefits. So that's how to enroll in Medicare. Now, to enroll in a Medicare supplement plan, just give me a call direct at 512-402-7902. I'll show you all the best options available and how to save you the most money as we go through the years. Let's talk a little bit, though, about what Medicare covers exactly. You have parts when it comes to basic Medicare, but when we're talking about Medicare supplement plans, we have actually plan letters. So let's start with the parts of original Medicare, which are Part A and B. There's also Part D, which is a drug plan. Another thing is Medicare Part C, which is an Advantage plan, which we'll talk about later. Medicare Parts A and B are what's called original Medicare. Part A covers hospitalization and Part B covers doctor's services. So what you'll hopefully be using the most of is just Part B for doctor's appointments or anything outpatient. There's no premium for Medicare Part A. Again, that's hospitalization, but you've paid that through employer taxes throughout the years. Medicare Part B, however, does have a monthly premium, and it's based on your income levels. That premium starts at $135.50 a month and can be paid quarterly if you're not drawing a check, or if you are drawing a Social Security check, it will be deducted monthly. Now, as I mentioned, Medicare Part B covers doctor's services. However, it does not start paying until a deductible is met. Now, this is called the annual Part B deductible, and it's once per year. Part A has a deductible, but it's paid by most of the Medicare supplement plans. After the Part B deductible is paid, Medicare Part B will pay 80% of your medical bills. Now, you are responsible for paying the remaining 20%. This is called coinsurance. So these deductibles, as well as coinsurance, are called the gaps in Medicare. That just means the expenses that you're required to pay. That's actually where the term Medigap comes from. Now, Medigap plan and Medicare supplement plan are the same thing. So to recap, here's the breakdown of how it looks with your coverage on Medicare. You have Medicare Part A and B, which cover hospitalization and doctor's services, also is known as Original Medicare. Because Part A and B do not cover everything, they have what's called gaps or expenses that you're required to pay. A Medigap plan or Medicare supplement policy can pay most or all of these gaps for you. Part A and B also do not cover prescription coverage, so if you do need that, you'll need to enroll in what's called a Part D drug plan. Now, my job is to save you the most money as possible on your Medicare coverage each year. So just call me today and I'll help you with the Medicare supplement plan as well as get you in the right direction with the drug plan. Again, I can be reached at 512-402-7902. So call now, we'll get you in the best spot with all your Medicare coverage.